Well, hello everyone. This is Dr. Mike Chua, physical therapist. Hey, today we've got a special guest. His name is Dr. Arvie Vitente from Lewis University DPT program. We'll be back in a few seconds, okay? Yes, we are back. Well, if you're watching live, comment live, watching on a replay, comment replay. But we got a special guest today. He's a good friend of mine. He's actually Filipino too. He's actually the program director and a professor at Lewis University. And then I've met him several times. I went to Chicago. He's just an amazing person. Not just an amazing person, but also an amazing physical therapist. But he's got multiple accolades and recognition. You know, he's a member of American. What you call this American Filipino American group. You know, he was also the faculty of the year at the Angeles University in the Philippines. He was awarded the therapist of the year at a national level. Okay, listen to that, national level for Medicine's home health. You know, that says something, ladies and gentlemen. He's also been honored with the Fred Rutan Excellence in Service Award in 2022. I don't know what that is, but sounds fancy, right? He was also recognized as an outstanding neurologic physical therapist in education in 2023 by the Florida PT Association. He's also a board certified clinical specialist in APTA and a lot more. And I know I can read all of this, but the most important thing is I have him today. We're going to talk about who he is, what does he do. Let's go ahead and bring in Dr. Arvie Vitente.
All right. Hi, Dr. Chua. How are you?
Dr. Arvie, what is going on? How are you? I miss seeing you, man.
I miss seeing you too. It's been a
Well,
while.
first of all, thank you
When
very
was
much
that?
for
You were
this
here like
time, and thank
last
you
year,
very
right?
much also for. I know, man. I think so. Last year or 2 years ago, I can't remember. But first, you know, for those people who don't know, my daughter is a PTA. She already finished her PTA degree, and it was Arvie who really mentored her to go back to do a PTA school, and then now, of course, he's encouraging her to go to Lewis University for the DPT program. But before I keep on going, Dr. Arvie, could you please tell us again who you are and what do you do, sir?
Oh, thank you so much once again, Doc. Doc Mike. My name is Arvie Vitente, and originally from the Philippines, just like what Doc Mike mentioned a while ago. I graduated from Angeles University Foundation in the Philippines. That was way back in 2003, and taught there for 10 years before I decided to immigrate here in the United States in 2012. And I worked in home health, and I love geriatric physical therapy, just like Doc Mike. And I practiced from 2012 to 2017. In 2017, I've decided that I miss academia, so I restarted teaching in a physical therapist assistant program in Florida, and the name of the college is Pensacola State College. I taught there for almost 2 years. And after that, I've decided I think I would like to teach in a doctor of physical therapy program. So I've decided to accept a position in Miami, Florida. And that was the University of St. Augustine for Health Sciences. That's when I met Doc Mike and accepted some of our students for their clinical education experience. So again, Doc Mike, thank you so much for inviting me in your show.
Well, of course, it is actually my pleasure, man. But for those people who don't know, Dr. Arvie is a very good professor. You know, all
Oh,
the students, 100%, of our students will say, hey, Dr. Arvie really mentored me about neurology. And I'm like, here, I'm like, don't ask me about neurology. Just ask Dr. Vidente about it. But Dr. Arvie, tell us again, what prompted you to go back to, I know you were a physical therapist back home. What prompted you to go advance your degree? Is it because
mhm.
of immigration, just like me? Is it because you just wanted to advance yourself? Tell me more about that.
Well, basically, when I came here in 2012, I've heard of the Doctor of Physical Therapy program, and there's a way for me to take this transitional Doctor of Physical Therapy degree. And it's just that I've seen some of the clinicians who have DPT, and one of my clients or one of my patients before asked me about the difference between if you have a DPT or a clinician without a DPT. So I told her about the entry level practice, and so I've decided to just go ahead and do my transitional DPT just to advance my knowledge about physical therapy, and at the same time for competition, right? Just to be honest with you, so that my patients would say that, hey, you have your DPT now. So yeah, just to advance my knowledge and at the same time to get that degree.
It's funny you mentioned that because that was also my driving force. So you came in 2012.
Yeah,
Man, you are so quick in going up to the
September,
corporate
September.
ladder. Man, I'm just so proud of you. This is what it's all about, ladies and gentlemen. Again, if you're watching live, comment live, watching on a replay, comment replay, because this is what it's all about. Advancing your degree. You're not in competition with other people. You're in competition with yourself. And
Right.
then, like what Dr. Arvie mentioned, why me? I came in here with a bachelor's degree. Yes, I have the therapy license and everything. And why would a certain company hire me if I don't have a doctorate degree? And you got this new up and coming students that has doctorate degree. They're much younger, good looking, physically fit. Me, I'm just good looking, right? We're just good looking, like Dr. Arvie, right?
Both.
So, so what are we? Why are they going to hire us?
Right.
So I also went back to school. I went back to finish my doctorate degree, and in that way, I could compete better, not just outside, but within myself and learning. And this is my next question, Dr. Ivy. Was it worth it? Because a lot of people will say, "Oh, it's not worth it. We get paid the same." Do you think it's worth it?
It's actually worth it, and it depends on your goal, right? Like for instance, for me, back in 20, when did I start my DPT transitional? So that was 2014. So my goal then was to transition eventually from being a clinician to being an educator again here in the United States. And you already know that most of the universities, they would like to hire someone with a DPT and board certification at the same time, terminal degrees. And by the way, when we say terminal degrees, we are referring to PhD in education, PhD in rehabilitation, or EDD, or Doctor of Education. So since that was my goal, it was worth it for me to complete that transitional Doctor of Physical Therapy program, for me to be able to go into academia. That actually opened the door for me to be hired as a program director in a physical therapist assistant program in Florida. So
That's
I
what I
think,
was looking
going back
for.
to your
Yeah.
question, I think it depends on your goal, right?
Yeah, yeah, that's what I was looking for. It will open up doors for you, ladies and gentlemen. And same thing with me. A lot of people are telling me, "Why would you go back? You already got your license and everything." I went back 2012. I finished it 2014, and then it really opened up doors for me. I was able to become a rehab director. Yes, you can be even a PTA can be a rehab director, but it gave me more confidence within me, in
Right.
myself. Hey, okay, I got my doctorate degree. I think I can lead the team now. And then, it it opened up opportunities. Now I have my own private practice, and I can say, hey, we got a doctorate degree, we got direct access. Patients can come in directly to us without, I mean, we still get the doctor's order. We ask doctors, the physicians permission and approval. Hey, can we do therapy? Stuff like that. But in essence, it gave me confidence and opened
Mhm.
that door. So, with that being said, Dr. RV, I know you already went to your doctorate degree, and then you went to USA and taught the class there. And where are you at now? I mean, what specific school are you at right now? What is a program director? What do you do? What are you doing at Lewis University, man?
So I'm here at Lewis University now as the program director for the Doctor of Physical Therapy program. But before I continue, I'd just like to comment on what you have mentioned a while ago. that we are collaborators, right? So we collaborate with physicians. And even if we have this direct access, we always communicate with them, not only with the physicians, right, but with the other healthcare professionals. And you would agree with me on this one, Dr. Mike, about collaborating with the nurses, with the occupational therapist, with the speech language pathologist, medical social worker, among others, right? Um, for us to better serve our clients, our patients, right? So it's always going back to that association, which is one of the values that we have here at Lewis University. But to answer your question, I'm here now at Lewis University, and to answer your question about a program director, I oversee the development of the doctor physical therapy program here at Lewis University, and we just received our candidacy for accreditation from CAPTE, or the Commission on Accreditation in Physical Therapy Education. And oh, thank you. And that's one of the things that you need to get prior to enrolling students. So we have our first cohort now, and the size of our cohort is 40. So that means that we have 40 students per year. We only admit one cohort per year, and our start month is every January. So we have a spring start. Yeah, so that's the role of a program director. So I oversee curriculum management. What else? The assessment that we have within the program, and the day-to-day operation of the program. So I also teach, just like what you have mentioned a while ago. I love neurology. I'm a neurology enthusiast. I'm not a neuroclinical specialist, but I'm a geriatric clinical specialist. And that's what's good about being a GCS. You already know this one because you have a passion in geriatrics as well, Dr. Mike. In geriatrics, we're catering to individuals 65 and above, right? And what's really good about geriatric
Why are
physical
you
therapy
looking
is
at me
that
when you say 65 and above?
no, you're so young, Dr. Mike. But what's good about geriatric physical therapy is that aside from balance and falls that we usually see in this population, we also see some comorbidities, like for instance, congestive heart failure, cancer, among others. So it's really challenging. So that's been one of the things that I've been mentioning to my students, that in geriatric physical therapy, although I know that most of you would like to be an orthopedic clinical specialist or sports and stuff like that, but in geriatric physical therapy, there's just a lot of things that we manage and address, including cardiopulm, including neuro, orthopedic, right? For instance, for people who are who did undergo total hip arthroplasty, right? A knee replacement, among others. So I just love what I do as a geriatric clinical specialist.
There you go. Well, I like what you said about serving earlier, ladies and gentlemen. If you are still watching, comment live and comment serve. I like what Dr. Arvie said. Not just because we got a doctorate degree, we get to be served. No, we are here to serve. Even here at the clinic, I always tell them, yes, I own the clinic and I own the practice, but I'm here. I always tell them, hey, what else can I help you with? I'm here to serve you. And that's the same thing with us, especially when you're dealing with seniors and geriatrics. We are here to serve. We are here to bring out the best in them. We're not here to get served. I mean,
Mm-hmm.
it's a different, serving, but you know what I mean? We're here to
Yeah.
help out. And same thing when yesterday we had a collaboration in our clinic. We have PT and OT, right? And yesterday we facilitated a telehealth where
Oh.
our actual PTA was there, and then I coordinated with the physician and the pharmacist, and then they're both there, and the pharmacist was like very, very appreciative. Shout out to Dr. Brad. And then very appreciative. Hey, nobody does this, so that's the collaborative care that we're doing. And it's very important that you have that, and that's what Dr. Harvey is doing in teaching. He's such a good what do you call a mentor in telling people, hey, you need to learn how to do this. Dr. Arvie, where
Mhm.
can they find you? Where is Lewis University? Is there an email or your bank account number, your social security? Could you please share us that number?
Or Venmo, right?
Yeah.
No, but I'm here in Romeoville, Illinois, and it's located here in the Chicagoland area. I always just say Chicago. It's because it's really hard to explain where's Romeoville, right? So it's like a 35 to 40-minute drive from O'Hare, which is one of the bigger airports here in the Chicagoland area. So you can find me on LinkedIn, Facebook, Instagram, Twitter, X. I'm sorry about that. And also you can email me at avitente at lewisu.edu. And the website is on there you go, on the screen right now. So please find me there if you have any questions about the Doctor of Physical Therapy program here at Lewis University. And I'm just really proud about the program that we have created here. It's a 7.5 semester program. So it's 2.5 years. And we have 112 credits. We're very competitive when it comes to the cost of education here within the state of Illinois and also in the country. And the other thing that I would like to mention about Lewis University is that we don't have a cadaver lab, but however, we're the first doctor of physical therapy program in the country, in the world, to have this specific technology, which is called Holo Anatomy by Alensha XR. Basically, this is like a hologram. And before, when I was still in the Philippines, and for sure, Doc Mike, you have experienced like going into the cadaver lab and to study anatomy. But in here, they're using
Mm.
Complete Anatomy, which is like a 3D app by Elsevier. And they can bring that home and study all of the structures. And then when they're here on campus, we provide them with this hologram experience to study the different parts of the body, right? So, which is innovative, and at the same time, after a year of studying here, like didactic, they will be, after a year, on the spring of their second year, they will be going out and really treat patients under the supervision of the faculty, a licensed faculty member. And we have this partnership with Mace Lake Village, which is an independent living facility located in Oak Brook, Illinois. So that partnership, we come there every week, and we provide physical therapy services to the residents there. So it's a win-win situation. We're in, we're providing services for free, and at the same time, they're allowing us to see their residents, and the residents are just so loving and caring, and allowing our students to provide the services that they were trained for, right? Which is physical therapy. So some of the values that we have here in this in this university, at Lewis University, is association and justice. And that's one of the things that I'm really passionate about social justice. And I know, Doc Mike, you are an advocate for that as well. And one of the things that we really teach our students is to really apply the what do you call this? The main or personal and environmental factors using the ICF framework, or the
Mm-hmm.
International Classification of Disabilities, Functioning, and Health. And that's just one of the things that we teach our students here, and to make sure that they have this service in their heart, which is one of the things that I'm really proud about our profession in physical therapy, that collaboration, the compassion, the caring values that we have in our organization. So those are some of the things that they will be learning in our program here at Lewis University.
Amazing, amazing. Well, You heard that word again, service. And if you need the QR code, ladies and gentlemen, it's right over there, the upper right-hand corner. You can also check out their website, lewisu.edu/academic/DPT program. And Dr. Arbor said 40 in the class. I mean, that is amazing. And then that holographic thing. I mean, we used to, I do actually, how do you say that? Cadaver?
And it's just 2D, you know what I mean? So we have the cadavers, and but they will be exposed to toxic chemicals, right? So like formaldehyde. And by the way, just so you know, we have 19 students only in our inaugural cohort. So and also for our incoming cohort 2, they will be starting next month. Can you believe that we have cohort 2 already? So we have like 32 students. But what's good about our program, Doc Mike, is that we are only having maximum of 10 students per lab. So that means that the ratio when it comes to faculty to student is 1:10. So that means that you will be getting more focused training and skills practice with the faculty. So that's one of the things that I'm really proud about in our program.
Wow, it's amazing. Imagine us before, right? 50 to 60 in the class, right? But again, thank you very much, Dr. Arvie. Appreciate you. Thank you. If you have any questions, reach out to him. But before I let you go, always remember the word FAST, F-A-S-T, letter F. Find people that will bring out the best in you, because you are the average of the 5 people you hang out with today. Hang out with Dr. Arvie. I feel like I want to be an educator like him, right? So next letter is letter A, take action. All the stuff that we're doing is not going to do me good. It's not even going to do Dr. Arvie good if you don't take action. Take action. Go to their website, lewisu.edu/academic/DPT program. Check out, take action. If you know anybody who needs therapy in Illinois, reach out to, right? And next, share and subscribe. The more shares, the better. Because it is really sharing is key. Last but not least, T is teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, just like what Dr. Arvie is doing, you're actually understanding it more. The more you teach it, the more you understand it. Again, be awesome, be great, be excellent, and we'll see you in the next episode.
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency,